Delivering primary health care to all Eritreans through community-based health services is a key strategic priority for the government of the state of Eritrea. The government operates 351 health facilities across the country. Yet, a number of communities in hard-to-reach areas are unable to access any facilities for regular health care. To reach such communities, the government has launched a number of programs which include health outreach services for all communities within 10 kilometers of a health facility, mobile clinics for areas outside the 10-kilometer catchment area, and the Barefoot Doctors. The Barefoot Doctors are frontline health workers who are trained and equipped to provide essential health services to people living in remote communities of Eritrea, communities that can only be reached by foot, camel, or donkey. All Barefoot Doctors have a minimum 8th grade education level and are able to read and write the language of the community they serve. Barefoot Doctors are not a new concept in Eritrea. During the liberation struggle, Barefoot Doctors provided basic health services to village populations in liberated areas. Barefoot Doctors are given 6 months of training, which include a focus on first aid and the identification of certain diseases and treatments that require referrals to health facilities. The doctors are taught how to provide antenatal care services and other forms of support for pregnant women, as well as how to tend to mothers and newborns and counsel on infant and young child feeding practices. The doctors are also trained in how to mobilize their communities around personal hygiene, nutrition, and environmental campaigns, and on how to support health workers during vaccination programs. To date, a total of 87 Barefoot Doctors, including 12 women, have been deployed to serve their communities in all 6 regions of Eritrea. Barefoot Doctors are lifesavers. Each Barefoot Doctor is provided with a stock of essential medicines and medical supplies which they are authorized to use for the treatment of common ailments such as diarrhea and water sanitation-related illnesses.
قدم بعراد جيرهم تسكيمهم نهيل سنتر يخدو نيرهم حجيجن أبزم مسمات أكاني نشع ولا نقدم أجردت فرسيد جيرلهم بهم أدحين يوم قبل خل ورقات جرنا صحفون تزي خيرهم كي عندنا تزي خيلهم نهيل سنتر يصدم.
Sometimes the Barefoot Doctor personally escorts the sick person to care. One of the key health behaviors that Barefoot Doctors encourage in the communities they serve is for pregnant women to seek antenatal care and to deliver in health facilities. The Barefoot Doctors are able to provide mothers with micronutrients and nutritional counseling, monitor pregnancies, and refer complicated cases to health facilities. The government of Eritrea prioritized the revitalization of the Barefoot Doctors program in 2019. While the Barefoot Doctors program is considered a temporary measure until new health facilities can be built, it is clear that the Barefoot Doctors program currently provides essential services that are important for expanding equitable access to health care.
أجار حكيم ناي حسود يوم ناي تيبي يوم ناي استفل عليه حمامات الصوم زبو أبركتو ناي بحق عبي نتو أبرحو زول هزبي مستزول ناي موقع عزيز أجم مستزول ناي قطابات أجم نتسرح ناي تي زلوانا تكالات عنا أمكلال عب أبركتو.
UNICEF is supporting the government's Barefoot Doctors program as part of a broader strategy to strengthen community-based platforms in Eritrea. Barefoot Doctors are a force, pushing forward Eritrea's efforts to realize the Sustainable Development Goals and universal health coverage. These hardworking men and women out in the front lines, going to the last mile to reach every Eritrean, ensure that no one is left behind.